Today we're going to talk about women's health.
We're designing supplements with women for women.
Endometriosis affects 1 in 10 women.
There are children as young as 12 on constant to manage their pain for their periods when they should be investigated for endometriosis.
Polycystic ovarian syndrome affects 1 in 5 women.
80 to 90% of women with polycystic ovary syndrome have insulin resistance. And that then obviously has its own issues linked with it as well.
One symptom women should never ignore.
Fatigue.
There's a bunch of myths around it. I was doing some reading and...
Well done, Barry.
Thank you.
Your reading was correct.
Now there's talk of the microbiome involvement in these conditions.
First, before I go on any hormonal therapy, before any pain therapy, is there a chance that my diet will be off?
What I really like about your company is that you do the science from scratch.
Bringing my microbiome research, which I've done for about 20 years, that makes me sound super old. Don't judge me. I started
It
young.
was in your intro. You're the oldest.
I'm the oldest.
What's the next move?
So it's really educating women about the fact that you need to continue to mind yourself.
Yeah.
You deserve to mind yourself, and there are other people looking out for you as well.
Hi everyone. Welcome to episode 11 of Straight Talking Science. I am Barry Skillington, Chief Commercial Officer with Atlantia Clinical Trials. I am your host, and today we're going to talk about women's health. Endometriosis affects 1 in 10 women. Polycystic ovarian syndrome affects 1 in 5 women. Fibroids affect the majority of women by midlife. We treat them as separate conditions, but what if the same systems are underlying them? Today, I'm delighted to be joined by Professor Siobhain O'Mahony for the second time for part 2. Siobhain is a professor in microbiome and women's health. She's a principal investigator with the APC Microbiome Ireland at University College Cork. She is one of the earliest research in the gut-brain axis for women's health, and she's the CEO of Fembiome. Welcome, Siobhain.
Thank you, Barry. Super.
So I want to start off by, why women's pain gets split into the wrong boxes, apparently, and it seems to be. And why would you say that is?
Probably because it presents in different ways. So I think a lot of the syndromes associated with women's health that are linked to pain, they're all linked to hormonal dysregulation. And even this word dysregulation can be really frustrating because as a normal, healthy woman, you have dysregulation across your menstrual period along the month and also through your life as well. So what we tend to see is that as the hormones fluctuate during the menstrual cycle and also during our life, we tend to see different symptoms coming out. So even in normal, healthy women, our pain levels change and tolerance changes across our menstrual cycle. Right. So I suppose the same system, if we're talking about the same system for all of these different painful scenarios for women, irritable bowel syndrome, endometriosis and so on, it's often associated with hormonal dysregulation.
Yeah. But surely the pains are different, right? I mean, they're, yeah.
Yeah, oh, absolutely.
Can people discern between different pains and different conditions? And so, yeah.
Oh, absolutely. So we have things like musculoskeletal pain, for example, that affects your muscles, for example. Then you have joint pain, but then you've also visceral pain. So this is the pain really that feels like dull, aching pain. And it's the pain you really can't determine where it is in your body. You know, if you feel like a pain, a cut or a pinprick on your hand, you can really discern where that is. When you have visceral pain from your viscera, from your organs or your guts or your reproductive system, from your ovaries, from your uterus, really this type of dull, visceral pain is really distressing. Mm-hmm. Most of the time because you can't see it and you can't identify what's going on within those organs.
Yeah.
So in women's health syndromes, often it's associated with pain we're talking about, is often associated with this visceral pain from the reproductive organs, or also organs that are outside or very closely associated with these reproductive organs within the peritoneum is what we say, so within your abdominal cavity. Whilst joint pain, musculoskeletal pain happens to everybody and also women across their life, but maybe it's easier to deal with and think about because you can see it.
Okay.
Yeah.
Okay. So like in polycystic ovarian syndrome, so it's described as a reproductive issue, but it's clearly not a reproductive issue. It's a condition of metabolism and affects mood and affects long-term health. So maybe explain, can you explain a little bit about what it is and how it presents and what can be done, if anything?
Yeah. And I suppose fertility issue is something that crops up time and time again for women's health issues. And it's probably because, this is one of the major things that we can do is produce babies. So I suppose one of the the, I suppose, things that they look for in some of these syndromes is if you can actually produce a baby. And it's only when people are trying to, I suppose, become pregnant, they go to their doctor, their GP, and maybe then they're tested for their hormones, hormone levels, their insulin resistance, and then maybe it becomes obvious that they have polycystic ovary syndrome.
Right.
Because some people, it is quite clear physically that they have polycystic ovary syndrome, and some it isn't. It isn't obvious at all physically. You know, physically, sometimes women tend to gain weight, they tend to produce a lot of body hair, maybe get pattern baldness as well, while other women, you cannot tell at all physically that they are suffering from PCOS. So therefore, it's only maybe when they present to their doctor to become pregnant, when they can't achieve pregnancy, that it's actually evident that they are suffering from polycystic ovary syndrome.
So, like, there's a bunch of myths around it. I was doing some reading and...
well done, Barry.
Thank you. So, cysts, fertility issues, insulin resistance is one that's often tagged with it. Is there any truth in those, like microbiome diversity changes?
Yeah.
Any truth?
There is truth.
Okay.
Now, your reading was correct.
Yep.
No. So it is called polycystic ovary syndrome. And the reason why it's called that is because traditionally there's been found to be cysts on the outside of the ovaries. And those cysts, a lot of those cysts are driven by insulin resistance. So nearly 80% of women with polycystic ovary syndrome, even though it's only called ovarian cysts, is actually even in the name, huge amount of the symptoms are driven by insulin resistance. So what we tend to see is that the insulin is not taken up by the cells, or the glucose isn't taken up by the cells. So therefore they produce more and more insulin, which means there's too much insulin in these women's bodies and floating around their body. Insulin then targets the ovaries to actually overproduce hormones, including testosterone and estrogen, that we know high levels of are associated with polycystic ovary syndrome. But so the cysts are on the ovaries, on the outside of them, but not on every single woman. The hormone dysregulation is present in most women. Insulin resistance is probably the one that we can definitely depend on. 80 to 90% of women with polycystic ovary syndrome have insulin resistance. And that then obviously has its own issues linked with it as well, because we know people with insulin resistance tend to develop metabolic syndrome, tend to have cardiovascular problems. So I know we tend to say it's a fertility issue, but really it's probably insulin resistance we should actually be treating. And maybe that's where the microbiome actually comes in, because studies nowadays are showing that bacteria within the bowel is disorganized or a little bit different with people with polycystic ovaries. We do know that the microbiome within the bowel, or the bacteria within the bowel, is associated with creating or balancing insulin. So it's the link between those two that people probably should be thinking about for treating PCOS.
Okay, and so diversity in people's microbiome could be an indicator of why there's such diversity within the diseases themselves.
Exactly.
Okay.
Exactly.
All right.
Now, the gut microbiome, as we know, because you've had several speakers on your podcast, is an enormous complex community.
Yes.
So even talking just talking about diversity is only one tiny, tiny measure of it.
Yeah.
So yeah, I mean, even healthy people have very different bacteria within their bowel, but it presents differently in different people.
Okay, and so the third villain, endometriosis, which is a complex disease. Even I know that. Yeah. So maybe, again, top line on what it is, how it presents, and then we maybe get into if anything can be done.
Yeah, absolutely. And this is something I'm really passionate about. I have an RTU grant working in endometriosis, and we work very closely with our patient population and focus groups. So endometriosis is a condition where you see the lining of the uterus. So the lining that, grows and regrows to actually help the baby form every month. But actually the cells in endometriosis tend to migrate out of the uterus into the area outside of the uterus that's called the peritoneum, basically. It's this area where there's loads of organs. I mean, you have your guts, you have your bladder. So these are all sitting very close to the outside of your uterus. So if these cells migrate outside of the uterus and adhere, they can adhere to the outside of the uterus, they can adhere to the bladder, they can adhere to the gut. And what happens then is they actually form adhesions between them. They have their own nerve cell system, they have their own blood system, making them actually complex lesions. So endometriosis is associated sometimes with infertility, a lot of pain, as you can imagine, because these lesions are very responsive to hormonal changes. That is normal and healthy across the menstrual cycle. So these women tend to feel an awful lot of pain and discomfort in their reproductive regions, obviously. They have a lot of pain on intercourse, they have a lot of mood changes, and a lot of women do try to manage their own symptoms because control with these women is huge, as in not huge. I mean that it's really difficult to diagnose it. It takes ages to diagnose, very difficult to treat. So women are trying to manage their own symptoms in order to take control of their own health.
And why does it take? That sounds horrific. Why does it take 7 to 10 years, the average, to diagnose? Like, why does it take so long?
Yeah, and this is something that has been around for a long time, as in like when girls get their periods, it could be as young as 11 or 12. And I mean, this is huge for a child that is young. And if they describe, oh, you know, I'm feeling very painful periods, I'm having very heavy periods, often it's seen to, she needs to kind of settle into it a small bit. And this isn't a myth. This is true, and it's happening these days. And it's not that every child that gets his period and claims that if they feel pain, they should be diagnosed with endometriosis. But investigation should happen. Periods should not be as painful to mean that a child has to stay at home from school. There are children as young as 12 on constant to manage their pain for their periods when they should be investigated for endometriosis. In Ireland, things have changed a little bit. Before, you had to have like laparoscopy, so a little investigation, a surgical investigation to determine if those lesions were present. And only if those lesions were present, you were diagnosed with endometriosis and treated for it. But nowadays we have this amazing framework within Ireland. Now it's still in the development phase. I'm working with amazing clinicians in endometriosis in Ireland to mean that these subclinics, you can actually be diagnosed with endometriosis based on your symptoms. So you don't have to have your 12-year-old go in to have surgery in order to determine the lesions are present.
Wow. And so like there is limitations to the surgery, like we know, and I suppose, I don't know how many people know, but I know people that have endometriosis and have had extensive surgery, and it helps, but it doesn't cure. And now there's talk of the microbiome involvement in these conditions, in all the conditions we just spoke about. And so maybe you could talk to the people about your microbiome research and how, you know, what you're doing in terms of women's health and microbiome research.
Yeah.
Fembiome being the company.
Thank you. Super proud. We've just set up a company called Fembiome. And the whole goal of this company is to design microbiome targeted interventions. So bringing my microbiome research, which I've done for about 20 years, that makes me sound super old. Don't judge me.
It was in your intro. You're the oldest.
I'm the oldest. But so, I mean, really trying to translate this microbiome research into real world solutions for women. So I'm a woman, so I'm designing the supplement, but we also talk to other women. We have focus groups, as I've mentioned in my grants on endometriosis. We have patient interaction forums as well. So we're designing supplements with women for women. Yeah. So asking women what their symptoms are, you know, pain and endometriosis, mood changes, quite depressed, quite anxious, for example, or in the perimenopausal situation, you know, sleep disturbances, brain fog. So asking women what their symptoms are, and then carefully selecting microbiome targeted interventions such as specific fibres, specific bacteria that produce very specific proteins that can produce GABA, for example, and alleviate anxiety, produce serotonin to reduce pain. So what we're really trying to do is pick out very specific ingredients and test them in those women, but only after we've spoken to them. We're asking women what they want. Yeah. That's amazing. So you can almost cherry pick species within the gut that have a specific effect, and then you grow those up and put them in a supplement or a fibre to address a condition. Exactly. Now we still have to, now within our ethos as well, we really do believe, now look, with supplements, you can just buy ingredients, put them into a capsule and sell them as you want if you're a good marketer. But what we really believe as well is, probably, I know it's a lot more expensive, but at the same time, it's for women. We believe in making sure that these probiotics or these bacteria actually work in the lab first. So we test them in a number of cell models. When we find out the actual ones that work, we carefully select them, put them into a capsule with our partners, of course. And we don't just do that in my lab. And then what we do is we create, I suppose, a trial design, a human trial design then. And again, of course, there's eligibility criteria. If we've designed a supplement, which our first one for perimenopause, we've designed it around the wants of women. So we recruited women basically that had higher anxiety levels, sleep disturbances, brain fog, because we've designed the supplement for this set of women. And then we've carried out a double-blind placebo-controlled trial with Atlantia clinical trials. I was going to say, it must have been a really good CRO that you... It was. I've learned what CRO is too now since. There's a lot from Atlantia. Yes. But yeah, like, it's a longer road. It's actually not a longer road. Like, if you ask people, how do we get from A to B? So we're launching later this year with our first product. It took 18 months. But I suppose it looks like it's 18 months to develop a product for women's health. I do have 20 years behind that. But, you know, you can involve women in your product design and then carry out a trial within a very efficient time frame. You know what I mean? Yeah, and I suppose maybe
I'll interject in that I've been in the food supplement space for if you think you're in this thing a long time, you want to see my CV. But so credible science in this industry is, I won't say rare, but it's certainly not the norm.
Okay.
A lot of supplements on shelf don't have a lot of science. They have inferred science or piggyback science from other people. But what I really like about your company is that you do the science, you know, from scratch. You talk to women, what is it you need, what you need me to fix, and then you go after that condition and you fix it. So that is really good. So if your line of your portfolio products continues on the vein, I think it'll be really good if it continues that vein.
Thank you.
So, and yeah, I just wanted to make that point because I'm in pharmacies all the time. I look at marketing, I look at, you know, different product portfolios and what kind of claims they're making. And there's very little. There's very little that really means anything.
Exactly.
Okay, so within the disease states, I suppose, of women, there's others that I literally just learned. Like fibroids I have heard of. Adenomyosis.
Yes.
Can you tell me what is adenomyosis?
That's all right. Yeah, there's a few that affect women, isn't there?
There is a few, yeah. Yes, I won't even say us lads have our own problems these times.
No, we don't go there.
Yeah, we don't.
Podcast, do we?
Yeah, you got it. You own it. Yeah. Okay, we lose.
So adenomyosis. So this is a condition that's kind of, people think it overlaps a little bit with endometriosis because it starts off with the same cell type. So we've mentioned that endometriosis kind of origin cells are the ones from the lining of the uterus, so the inside that actually, you know, leaks out as you have your menstruation and so on. So the same cells that actually are the origin cells of the problem for adenomyosis. Except with endometriosis, we mentioned that those cells actually leave the reproductive system, so get outside the reproductive system. With adenomyosis, actually, the lining actually inserts itself into the muscle. So the uterus is this major muscle, obviously. We know how important it is and how strong it is.
Yeah.
So, the cells of the lining of the woman adenomyosis actually invaginate into the actual muscular tissue. Leads to kind of a painful feeling around the uterus. Leads to, you know, heavy bleeding as well, painful periods, but also infertility is linked to adenomyosis as well in certain women. But again, the issue, I suppose, where it doesn't overlap with endometriosis is that we don't have the other organs involved. We don't have the GI tract, we don't have the bladder, but it's really focused on the uterus, which is severe in itself.
Okay, still sounds not
really
great.
tough.
Really tough, yeah. And then fibroids. I did mention them in the intro, but what are fibroids?
Yeah, fibroids are more the tissue that grows in the muscular wall. So they're lesser, I suppose, they're very common in women, but they're probably only found when some other investigation is carried out.
Okay.
We sometimes don't see, I'm not going to bring infertility up into all of these conditions, but when you actually Google any of these, fertility is everything, the first thing that comes up.
Yeah.
But often women with fibroids tend to not be deemed infertile. But anyway, it's mainly because the tissue that leads to the fibroid generation is different to the other two conditions, endometriosis and adenomyosis that we mentioned.
Yeah.
But it actually grows in the muscular wall itself. It starts in the muscular wall. So what you tend to see is enlarged areas of muscular tissue associated with the uterus as well. So very localized to the uterus wall. But not much, like when you see the list of symptoms associated with endometriosis and then the list of symptoms associated with adenomyosis, it's not as long for fibroids and doesn't seem to be as severe or impactful on a woman's life in general. And again, we see the whole, you know, anxiety, stress, because of the burden of pain with the first two. It's not quite as common to have as much pain or as much, I suppose, mood disorders and anxiety with fibroids as well.
Okay. So can they be underdiagnosed or under...
Exactly, not found at all.
Right.
Yeah.
Okay. It's great. Oh my God.
You're learning
Look at all the things that can go wrong. Yeah. So now the estrogen, which I've heard you talk about.
My favourite community.
Yeah. So the one concept that women should understand from this conversation is the estrogen.
Yes.
So I'm going to let you have at it and tell them all about it.
So, you know, we've seen on this podcast, we've seen in many different places that your bacteria in your bowel are really important. When we talk about women's health, there's a specific community called the estrobiome. And it sounds like what it does, it's associated with estrogen metabolism. And that's grand because we hear bird metabolism all the time. But I suppose, what does that actually mean when it comes to the estrobiome? So when we actually, I'm going to start a little bit at the start with hormones.
Yeah.
So when we actually, we produce hormones, we need them to carry out specific actions in our body. There's lots of different hormones. The hormones that we're interested in, mainly in Fembiome as well, but for the estrogen are the estrogens. You have 3 different types. You have 3 different types and they have 3 different functions, and the 3 of them, some of them are have stronger effects than others. Your estrogen doesn't differentiate between the 3, which is fine. That's fine. What we tend to see is that your liver is also important. This should be taken away from today as well. Minding the liver will mind your gut health and your estrogen as well. And your estrogen.
Drink.
But what happens basically with estrogens when you're trying to cleanse them, get them out of your body, excrete them from your body, when you don't need them anymore, because there's certain symptoms or syndromes like endometriosis when there's too much estrogen, or then in polycystic ovary syndrome we see too much testosterone and too much type of 1 estrogen, because you're not cleansing them potentially in an efficient fashion. And the way to cleanse them basically is they travel to the liver conjugates them, so sticks something onto them to make them water soluble. Then they travel to the gut and they should get excreted with feces in a normal, healthy fashion, or hormone balanced individual. But this set of bacteria is specifically in your bowel to allow recirculation of hormones, because some people aren't efficient at producing hormones. Some people can't retain the hormones, and sometimes it's too low level of hormones in individuals. So this specific set of bacteria are actually recycling the hormones, which is beneficial in syndromes where you have low levels of hormones. You don't want to excrete your own ones. But where you have too much, too a high level of these hormones, you really don't want this community to work efficiently. Because what they do is, as the hormones, estrogens, are passing through the gut, they actually deconjugate them, so make them water insoluble, so they go back into your system. Now that's very positive in a perimenopausal woman where her estrogen levels are declining. She wants her estrogen to actually bloom and to be able to say, okay, this estrogen passing through my gut, deconjugate that and put it back in to the system, put it back into my blood system and allow it to circulate to where it's supposed to go, to bone, brain health, and so on. But if there's a syndrome such as endometriosis, potentially there's too much of these bacteria there, allowing for too much recycling of estrogen.
So manipulation of the microbiome is a possible solution. And I don't know if you've ever thought of that for a future supplement, but I'll just put it out there. You can have it. I'll give you that idea. So obviously that's their targets, future targets for you. And I know that you and your lab, they're working furiously on lots of different things. So like in terms of, let's just tie the bacteria, somebody has these conditions, and we'll recap in a second, but like for your bacteria, what can you do? I mean, we know the diversity, eating and everything else, but like, what should we know? What should a woman know? What should she go after finding out in terms of her makeup in relation to conditions that are hormone related? Is there anything you can do?
There is, definitely. So I suppose, if you're a healthy, happy woman, then I think, and you don't feel any symptoms associated with your reproductive system or in general, you're feeling fine, then just eating a healthy, balanced diet and maintaining what you're doing is perfectly fine. People don't have to chase extra things if they're feeling perfectly well. But for example, in somebody that's endometriosis, they'll now want to clear the estrogen. So you can actually so we know the fibre is really good for feeding bacteria. That's great. We don't want to feed those estrogen bacteria too much in people with endometriosis. What fibre is also really good for doing, probably the primary function we've all heard of it doing, is allowing elements to pass through the body. And that is actually, if you can't do that, you can't survive. So you do need to go for a poo every single day. So it's also a very efficient way to get rid of waste. And some of that waste is our estrogens. So increasing fibre, like psyllium husk, for example, is really good at binding those elements as they pass through our gut. Because if you think about it, most of our bacteria actually stick to the bowel wall. So unless our estrogen can get to the bowel wall and get deconjugated and go back into our blood, it's not going to recirculate within our body. So like high levels of fibrous foods like our insoluble fibres, psyllium, can actually keep the momentum going within our gut and keep excreting the elements we're supposed to keep excreting. But then, of course, you do want to include elements like polyphenols, to keep your gut healthy. So like our berries and things like that. Of course, nice fibres as well, like oats, will feed the estrogen as well, and flax seeds.
And not all fibres are the same.
No.
So and I know we've said this probably in previous episodes, but like there's soluble and insoluble, and then there's better sources of. So psyllium, you're saying, is a good one for.
Really good for maintaining healthy motility. And again, if you're a person that has healthy motility, you actually don't think about it. But a person that has too slow, like slightly constipated or a bit of diarrhea, it's then when you start to think about what should I do? You know, you're getting enough fibre if you're not even concentrated on your gut. But adding psyllium into your diet actually does allow you to actually have a healthy motility, so healthy toilet activity.
Right.
Which is really important for women's health too.
Yes, absolutely. And it's like, you know, nothing's off limits on this podcast.
Excellent.
Yes. So I was going to say, has it translated? But you've answered that question. I mean, there is probably products out there, but are they good? Do they work? Or are you're on your own a lot? Well, even so, in terms of endometriosis, maybe I'll just do a mini recap. Like, you're not a medic, but you're a researcher of women's health, and so the medical community rely on what you produce in terms of research. When they make diagnosis, these are the strategies you can have with this disease. You can do this to try and manage the disease. And a lot of that comes from labs like yours that are providing the only evidence out there. So, in terms of like translatable strategies, I don't see a lot of products on the shelf for, and I don't know, maybe I don't know, but for endometriosis or fibroids, there's not.
No, there's not. Okay. There's not. There are a few gummies I saw recently, and as a therapy for endometriosis, and actually it was just vitamins.
All right.
Now everybody needs vitamins, that's fine, but you can get them from your food. But I mean, it was packaged beautifully. It was like, don't quote me on that name, but just in case. But there was, and I was like, wow, is this amazing? And I was in the supplement aisle, and no, it was minerals and vitamins, which is fabulous. But you really shouldn't get people's hopes up. Yeah. And people don't know the science that goes into the development of supplements, or the lack of science that goes into it. Yeah. So what we're doing in our endometriosis, so we have a large endometriosis EU grant. It's 5 years. It's working with 12 different partners across the EU. So this is the type of science and research translatability that I would love to see for all women's health conditions. Yeah. What we're doing is we started off basically with patients. We asked them what they wanted. They want empowerment. They want to be involved in our research. We're doing that. We also did a survey, I think, of about 2,500 women online to ask them what dietary interventions were they currently using to manage their symptoms. And exclusion diets seem to be, excluding alcohol, excluding caffeine, excluding gluten, do seem to be the most helpful when it comes to reducing pain for endometriosis. But there was no, and we asked them, I think we gave them 40 or 50 different minerals or vitamins to ask that we asked, did they take, and also probiotics, did you take that, and so on. There was no overall cure diet-wise for endometriosis and pain, which now we're starting to investigate. So now we're starting to investigate, is there a baseline problem in the microbiome balance in endometriosis before they start to take hormonal interventions from their doctor, before they have surgery, before they have a dietary intervention, before they have a cognitive behavioural therapy intervention, which we're doing in our trial or in our study. And it's across Europe. We would have used Atlantia if we was in Ireland. It's across Europe. But so we're starting with baseline. So thousands of women. We have 3,000 women enrolled in our study. Oh, wow. We'll do baseline microbiome analysis, shotgun sequencing, to see if there is any baseline differences that we need to manipulate using diet and fibres before hormonal intervention is used, before surgery is carried out. Because we've done studies on surgery before, different condition now, non-endometriosis, to show that you need to have a very stable, healthy microbiome pre-surgery so you don't develop pain post-surgery. Okay. So what we need to do, and what we're actually doing with this endometriosis study, is defining what is a healthy microbiome platform to allow these women to get the most out of their intervention. Because hormone therapy, surgery are the majority of interventions that are used to help these women. And we're not saying microbiome therapy is going to fix endometriosis. Right. It's
part of the strategy.
It's part of the strategy, because drug interventions, hormonal interventions, all rely on microbiota. Yes. All of these rely on microbiota to be effective for people. Yeah. And there's such a homogeneity or heterogeneity across people and across endometriosis that we're trying to find this baseline to get them all to, so they get more benefit out of their therapy.
That's a really good strategy for any.
Isn't it?
Yeah.
Yeah. It's amazing. But if it was applied to different women's health conditions, it would be amazing.
Yeah, because I had a question like, what research is still missing? But really, that's the research that's missing.
It is. And look, that's huge. That's an enormous grant. And we can't say anybody can afford to do that time-wise or money-wise. But what we do have now is we have all these open access microbiome data sets. Yeah. So we can actually try to mine those data sets in order to see if there's a certain profile out there associated with certain disorders. Yeah. They can say, okay, well, that needs to be, you need some fibre in on top of that first before you actually take an intervention, or, mining data sets is maybe a cheaper, faster way to do what I described.
I'm reading it. Sorry.
Read away.
I am listening. Okay. So we talked a bit about a lot of the next page coming, okay? So like evidence versus hype, what can women actually do? We've talked about some of the strategies you can actually do. So balanced diet, fiber, and there is medical intervention, so we don't want to downplay medical intervention at all. But oftentimes the drugs, not that they don't work, they only work for a specific thing and they're not really addressing hormone, especially hormone type, well, says the expert. In my expert opinion. I know, but so hormone type diseases have it seems to me like a broad base of symptomology that's hugely diverse because hormones are very diverse. And as you said, the heterogeneity within the microbiome is such that drug companies rely on the microbiome. People maybe don't understand. You eat something, it doesn't, bread doesn't go into your bloodstream. It has to be broken down in your body. It's the same with drugs. It's the same with supplements. It's the same with everything. So your bacteria break it down into something that has a benefit downstream. So in hormone conditions, like other strategies, is there anything else? We've covered a lot, I know, but fermented foods and supplements and... Yeah.
So I suppose in situations where you're missing microbes. So we've talked about maybe reducing the estrogen in conditions such as polycystic ovaries and endometriosis. But there are certain conditions where you're missing microbes.
Yeah.
And that's maybe across the life stage or whatever, and there's certain reasons for it. Particularly in perimenopause, you tend to lose certain species that are really good at, making the most out of isoflavins, for example. So then then you should consider taking, fermented foods, yogurts first, and maybe then a probiotic supplement designed by a company called Microbiome.
Oh, Microbiome, I've heard of that. Okay, so that's good. So yes, so specific foods for specific reasons, not just because, they're good for you. There's a definitive reason why you should be potentially
good. Some of our colleagues are actually now, you have kefirs and you have kombucha.
Yeah.
And some of those, I suppose, communities were not really aware of what exactly is in them, like the bacteria. Mm-hmm. But some of our colleagues at APC are actually now defining which microbes are important within those communities and how to actually kind of man-make, specific communities of kefir or kombucha, which is really nice. And that could be applied to women's health.
So there's prebiotics and probiotics, and I think we've addressed before in previous episodes, that there is differences, prebiotics being the scaffolds that other biotics grow. Is it fair to say that when you have a disease like we've talked about, or in a condition, that you need an arsenal of tools, treatments, thank you. So it's not just one thing. It's not just the drug that the doctor gives you.
Yeah.
It's the food you eat. It's the lifestyle regime.
Yeah.
It's keeping your liver healthy.
Yeah.
It's how much fiber you eat and go after it, calculate the numbers. You can do these calculations. They're quite simple, and you can take psyllium, which is 100% fiber, and just add it.
Yeah.
And it tastes...
divine?
Divine-ish. If you like cardboard, it's divine. But anyway, so yeah.
Yeah.
Which leads me on to, so there is that, but now it's a what's next, Siobhain? What's the next thing? So you have Fembiome, you have this company, you have amazing platform technology, so you have the ability to address a lot of these issues. And I'm not saying you can, obviously you can't do everything.
No.
But you can do some, sorry, I hit the microphone. Tell me about Fembiome, what's the next move?
Yeah. So no, and it would be amazing to be able to cure everything. But I suppose something I've learned along my journey is that I need to focus.
Right.
So focus is good.
Yeah.
And that a lot of people we interact with know that we're working for women's health and trying to drive things forward for women. So we're doing a lot of educational pieces as well, and doing a lot of kind of educational events around, because we do blogs online, which is lovely. But I think women really love to get together and to educate themselves or to, to chat together. So we're doing a lot of those things in order to, I suppose, raise awareness of Fembiome and that other women care about you or we're doing something for you. So it's really educating women about the fact that you need to continue to mind yourself.
Yeah.
You deserve to mind yourself, and there are other people looking out for you as well. So our first supplement will launch for perimenopausal and menopausal health, particularly around brain health and or maintaining hormonal health, which is what we saw in a clinical trial, which was fabulous. Calming, our product actually produces a calming effect. It brings women's energy back and gives them back what they say themselves. they say, I felt like I was myself again.
Okay.
They had their confidence back.
Wow.
And that's a huge thing around perimenopause, that somebody's confidence tends to go. I couldn't believe this when really strong women in my life were describing how they weren't confident anymore.
Yeah.
So yes, it was the boost of seeing that effect in the trial, and now being able to launch a product, hopefully later this year, put it on the shelves as our first product. But then we're not stopping there. We do want to help women in other stages of life, for example. And again, launching potentially the second product at the end of 2027 once we get the first one onto the market.
Brilliant.
Yeah.
Okay. And so that's what differentiates you from other supplements, is it's about core science.
It's about core science, and that's why it won't be, the second supplement won't be on the market like 2 months after.
Right.
Because we don't just buy the ingredients and put them together.
Yeah.
Currently, the science is ongoing in the lab. I have a phenomenal team of scientists working towards generating the second product. And they don't just care about science, they really care about women's health. And they're a team of young people all in their 20s.
Right.
So they're really interested actually in PCOS, designing supplements around premenstrual syndrome as well. So maybe, a lot of bloating, mood changes before your menstrual period as well. So because I suppose there's a team of young women working in my lab, they're eager to address the issues that are facing them ahead in their life.
That's lovely. It's a team of women working for women.
I have one man.
Oh, do you? Well done. Well done. Well, there is the whole representation discussion, which we won't get into here. So, okay, where do you still see the science is evolving or lacking? Like, what's missing? Why isn't there 50 or 60 supplements already on shelf? Like, why is it taking so long? Why are you, no slight intended, but how come you're the first?
It is bizarre. And you talk to like commercial people and they're like, why isn't this being done?
Why is
But honestly, I've gone to conferences, but both, mostly scientific conferences all my life. And there is nobody talking about women's gut health for their hormonal health. They're not
crazy?
There is a knowledge of the estrogen out there, definitely.
Okay.
And there might be 1 or 2 products, I think, that we're starting to look into the estrogen, but I don't know why. It's really about, when we talk about women's health, we've brought this up earlier, and I've mentioned the word fertility many times.
Yeah.
Nearly to my frustration, women aren't just on earth to have babies. We know that. They have more capabilities than that. But I suppose there's lots of different things that we can actually think about. But a lot of conferences I go to are really focused on women's vaginal health and vaginal microbiome.
Yeah, yeah.
Conference I went to 2 years ago, I think I was the last to speak, which is unusual, which is fine, but nearly everybody was asleep, I suppose, at that stage. But I really brought up the point, and I was talking about women's gut health, I really brought up the point that this was a phenomenal conference, but this is the only gut health talk for women. And I was like, why is nobody else talking about gut health? And actually, people have come to me across the world and said, you look like you're the only person. I can't be, but you look like the only person talking about women's gut health to actually maintain their hormonal health and brain health, specifically for women. And now since then, that specific conference I was speaking about, there has been loads of gut health for women introduced into it.
Okay.
So people are researching it, but they're not applying it to supplement development, which it needs to get to. And that's for all trials. We do need to differentiate between men and women for all trials.
Yes.
And particularly around gut microbiome, which may seem like gentle science at times, but it's not. The microbes within our bowel are extremely powerful. They work differently for the different sexes. So designing sex-specific supplements to optimize the microbiome is really, really important. And I have no answer for you why I'm the only one.
Well,
I don't want to be
more power to you. That wasn't really the question. It's like the question is what we're getting wrong, and clearly the target has been off, and it's all been vaginal, and now you want to bring gut into the picture, which is relevant and pertinent. So, like, another question is, what are we still getting wrong in women's health? But obviously, that's really part of it. Is that misdirected research piece and
specific stuff
and underrepresentation in clinical research?
Absolutely, yeah. I was on a panel recently, and it's like, you're advising people on how to design their trial when they want to include women, and it seemed really negative because it sounded like what I was describing to them was going to quadruple the money, and I was like, it's not going to quadruple the money. You need to design your trial for who you're designing the supplement for or designing the drug for. Now, I know we'd love to see drug therapy for across the life stages of a woman, but that isn't the case. Maybe from 20s to 40s is fine, but then in adolescence and perimenopause, you do really need to design your trial in a very specific way, because you have to take hormones into account, because so many other things affect hormones. The panel I was on was for pain, basically. And if we think about all the factors that affect hormones, like your immune system, for example, your lots of other systems in your body. So therefore, you really need to stratify for your trial, definitely.
Yeah. And like we do a lot of women's health studies. I think the majority of the people in our database are women. And so it's no additional burden. But one of my questions here was, what's the role of women in research? I mean, so you have to get involved.
You have to get involved. I think women are really proactive about getting involved, to be absolutely honest. I think the recruitment for our trial worked out really, really well because we had spoken to people beforehand and they said, no, we'd love to be involved. And like, obviously you're super at recruitment, but they have to get involved in other ways as well. Like they have to, like setting up a focus group was super, but out of a group of 40, we had 8 that were interested. While it'd be great to have more voices, you know, to actually inform our science and inform our research as well. Yeah. No, so women do need to get involved and not be shy and stand in the background and go, this isn't for me, it is for you. And that's what we're doing.
And it's for your daughter and it's for everybody,
Exactly.
Right.
And it's also what we're not doing as well is, and it's not coming down to just women in schools, we do need to start educating young women and men in schools about polycystic ovary syndrome and endometriosis really, really early. And we're not doing that. So that's how women, but also men, can get involved in women's health science and research as well.
That's really good. Okay, so there's 3 questions here.
Oh my goodness.
Yeah. I want to pay homage and a testament to the team that you can't see behind the camera. So there's Preksha, and there's Shane, and there's Amy, who basically do everything. All I do is sit here and ask the questions. But, you know, so anyway, I won't even pretend I wrote these questions. So one thing every woman under the age of 30 should understand about her body. They're like quick fire questions.
Well, that there's a whole community of bacteria working about for you, so mind them.
Ah, okay. Good answer. One symptom women should never ignore.
Fatigue.
Oh, fatigue.
Yeah, I know it's a random one.
I was thinking pain. I was thinking you're definitely going to say pain.
No, like, well, we have pain, but sometimes we know what pain. There's, okay, we have pain here, we have pain there. You'll go to your doctor. Like, I don't think people ignore pain that much.
Okay.
When it feels serious, maybe. But fatigue, there's so many. If there's a reason for being fatigued, that's fine.
Yeah.
So you think about it, why am I exhausted for a week? You should be exhausted for a week if you're a young, healthy woman.
Right.
Or a woman, whatever, in your 50s. You shouldn't actually be fatigued at all. B vitamins, for example, again, increasing your fibre in your diet, trying to get out for more exercise. So women are going around absolutely knackered. Yeah. And like, they're not actually addressing it. It's like, oh, maybe I'll sleep better tonight and I'll be better tomorrow.
Yeah.
People are completely ignoring that they're fatigued and they're worn out. They're not able to actually physically do their daily activities then, and they can't get out for exercise. And you don't mind your diet when you're feeling fatigued.
Yeah.
So yeah, sorry, that wasn't short.
That was good though. Okay. The last question. One question women should ask their doctor more often.
Ooh, doctors don't want me to answer this because they don't have any time. One thing they should ask their doctor, how do I mind my diet? They also maybe don't have time for that. But I think it would be really good if we had our doctors, our GPs, actually more kind of in tune with diet. I know I've spoken to many like GPs and gynaes as well, and they're really interested in diet.
Yeah.
It's like they don't have the capacity though. So maybe educating GPs and gynaes a little bit more about the estrogen and diet interventions would be good, because that could be a quick question. Then you don't have to go to a dietitian as well. You don't have to go to somebody, somebody else to ask that question. If you can go straight to your GP and say, first, before I go on any hormonal therapy, before any pain therapy, is there a chance that my diet could be off?
Yeah.
That would be super, but that's a long way off. And I know it's faster and easier to take a drug to maybe cure the symptom that day or to ease it that day. But if diet could be added in on top, that'd be super.
Okay. Yeah. And by diet, you mean microbiome, really.
Exactly. Yeah.
Because again, the downstream thing is, diet is microbiome. Very good. That was a lot, covered a lot, but I think it was very clear.
Well done, Barry.
It's very clear. It's very clear. Yeah. Yeah. I'm proud for all women. Thank you so much, Professor Siobhain O'Mahony.
No more than welcome.
And maybe there'll be a part 3 in you. Who knows? But thank you to everybody for watching. Like and share. The more you like, the more you share, the more we can do this, the more episodes we can create to push general knowledge around condition-specific diseases in men and women, and men and women. So yeah, stay tuned. Thanks a million.